Uh, we are having here a model of the spine, assuming that the apex is here. And as we can see, this is assuming this is the most wedged vertebra. So we put a screw above and a screw below the most wedged vertebra. And we connect the apex with a rod, either with the proximal anchors or with the distal anchors. If it's in the middle, it's preferably to be with the proximal anchors. So we take the rod and we connect it with the apex, and we connect this rod with a distal rod that comes with the distal anchors. And there is a domino in between them. Here is the domino. So what we should do, according to the APC technique, we just get the screws like that, and we hold them in a way that we do three procedures. We do compression, medial translation, and derotation. Medial translation is usually done when you have the proximal anchors connected with the same rod with the apex. So it will be translated medially already. But to preserve your translation, you need to have the domino always, the tethered rod, the domino is locked, always. And always put the rod 5.5 titanium or 4.75 cobalt chrome. But if you have a 5.5 cobalt chrome, that would be much better even. But never to put as a tethered rod 4.5 titanium, never. So what we should do, we take, first of all, we lock, we have these screws controlled, and can you please hold these? And we have a compressor. Can you hold the domino, please, in a way that it would be? Yeah. So we'll do compression and derotation in the same time. And as we can see, it will unlock the domino to preserve the position that you have done. And then lock the screws. Usually the screws, it's much better to have monoaxial screws. Can you remove these, please? So we have here a corrected apex, locked domino. This domino is sliding. It should be at least 4 centimeters. So we should have 4 centimeters to slide. You don't need in the convex side to put a butters or anything else. Then when we finish that, we go to the concave side. And we connect the proximal rod with the distal rod with a domino. And preferably that the proximal rod is the one that will be sliding because it's related to the chest. So we'll just connect them. This is, I'm sorry, can you remove this, please? This is the domino that connects them. This is a buttress. Actually, the buttress, because we don't have a one, you can have just a head of a screw, or you can have a hook or something. It doesn't need to be big. So it will just be a buttress or just proximal to the sliding one, sliding rod, and proximal to the opened domino. So we'll have a rod holder here, please. And we'll have a distractor, yes. And you, do you see it? Do you see? Is it exposed?
A bit.
Okay, can you come? Okay, so we'll just do a distraction here. Yeah, here you go. There is a distraction. Then you lock the buttress. And this should be at least 4 centimeters for the gliding in the future. So with this thing, we have a fusion technique for controlling the apex, and there will be a sliding here distally, at least for, and sliding here proximally. What are the variations that we might have? If it's impossible, for example, the apex is lower down, you can connect the rod, the lower rod, to be the tethered rod. But don't try to put a domino proximally, because it will be a stress riser to dislodge the proximal screws. Try to put the domino in the middle or in an area that can be covered and away from the proximal anchors. This is a thing. The other thing is that you try to put the rod, the tethered rod, that will be translated medially. You try to put it medially here, but it's not absolute. So if it's impossible, just put it laterally, but you also translate it medially with the process. One other thing is that with the distal ones, try to have the sliding rod, the thoracic one, but if it's impossible, just put the distal one as a sliding one, and you put the buttress distal to it, because it will slide here. It will not slide distally. So these are the things that we should do. The other thing is how to put the screws here. You just go 2 centimeters lateral to the spinous process. It's here. And with your hand, you can see the longismus. After cutting the muscle above, you go and you can see the longismus, which is white, having white threads, and you go just medial to it. When you go medial to it, you'll just see the edge of the transverse process with the vertebra, and you can know, because you are used to the freehand technique, you can know where to put the screw. So nothing like periosteal dissection, nothing like distractions a lot. You just cut with the bovie. You cut the muscle above, and then you see the longismus with your finger, you go just medial to it, distract it a little bit, and just go to the side to put the screw. Here, proximally and distally, just put it in a regular, normal way that you distract the periosteum, put it in an appropriate way. The proximal and distal anchors, it's preferable to be polyaxial screws, because proximally, with the kyphosis, it's much harder to put the rod and not to dislodge it with monoaxial. So you put polyaxial here, and monoaxial, so as to control the rod much better. These are the things that I want to show about the APC technique. That's it.
Thank you.